we'll throw it open and see whatever people would like to talk about. But tonight, the topic I thought was interesting was complacency and recovery, and how that looks and maybe what we can do about it. And so to me, complacency is kind of a sense of satisfaction or contentment about where I'm at. And it's something that I think can happen when one works a good program and gets into recovery and a lot of positive changes happen. And I think it's often in early recovery, especially, everything is new and exciting. And for me, it meant a big break from isolation, and I was connected with people, and I was feeling better because I wasn't ingesting all kinds of stuff. And just, so it was a lot of exciting things, new life, new changes, new beginnings. And I got sober in New York. We called it a pink cloud. And I think that's pretty much a standard thing. And the pink cloud is just kind of the euphoria that happens after we just kind of break those toxic patterns. But it's really an early stage, kind of like what we talk about in relationships, the word limerence, which is that kind of emotional altered state, feeling good when you first fall in love with somebody. It's all kind of rainbows and unicorns, and that can happen in recovery as well. But eventually the pink cloud on its own fades and people get back to work on their program. But occasionally, once things settle down, you can fall into some complacency. And by that, I mean, after the novelty wears off, complacency can set in. So what does complacency look like to me? Some examples. People may stop going to meetings or cut down on their meetings. People may stop doing service or getting involved with other people. People may stop being, I like the word teachable. And I think we have teachable moments in our lives. And certainly bottoming out on addiction was one for me. But I think we need to be teachable all our lives. And by that, I mean admitting I'm wrong, learning from my mistakes, being able to own my part in something, for good or bad, taking responsibility, and having less ego in the process. And I think if we're working a healthy program of recovery, that kind of is all in balance. But if I get complacent or cut back on actively working, I think those things start to grow. Maybe we stop working on ourselves, slow down on the steps, stop the steps. Maybe we should be in therapy dealing with something and we're not going. Maybe we're just not aware, not being mindful or conscious or woke, walking through our lives. And I think at those moments, can old self-deception start to think in? Because remember, a lot of the patterns we had in our addiction don't go away. They kind of fade, but mine are still kind of hardwired in me. So I can start to rationalize. I can start to get into black and white thinking. I can start to fool myself in a way that's not healthy. And sometimes changes happen too in recovery. Life doesn't stay static. So we may have a divorce or a breakup or have a baby or get married, or these life changes that can kind of impact how we feel about things and require us to kind of do a rebalancing of our priorities in our lives. And that can really kind of take center stage and push recovery off to one side. I think that can be dangerous if that happens for too long. So all this really, really heightens the risk of relapse. And so I wanted to talk about a few things that I found helpful to deal with this complacency and to really reduce the risk of relapse should that happen. One is just to be aware that I'm in danger. I think sometimes, for me, I go for a feeling. So am I kind of in this kind of bored state of like same old, right? I mean, are things kind of repetitive, not exciting, not vital? Am I not really feeling engaged? Am I doing it by rote? Are things kind of gray as opposed to being bright and colorful? And I think eventually I'll hit a point of resistance with that. The other thing that can happen, it's not exactly my pattern, but I've seen it with a lot of friends and clients, is that if their addictive patterns were more about stimulation and intensity, then sometimes in recovery, things kind of smooth out. We go to work, we come home, we play with our dogs, we have fun with our partners, or we eat at our favorite restaurant, or whatever. Life kind of goes on. But suddenly, we can hit a point of resistance. If things are going too smoothly, sometimes people shake it up a little bit. I've had a lot of clients who felt bored felt stale and kind of needed the drama, and they created it. And so I think that that's a real risk sometimes, to really be alert to our need to not upset the apple cart. The other thing too about knowing when you're in danger, I think years of recovery don't matter. I've seen a lot of people who really feel kind of they've banked some years into their recovery savings account and they don't really need to worry so much. I think that's a big mistake, because I think at least for me in my recovery, if I'm kind of not moving forward, I'm moving backwards. There's no such thing as static for me. I have to kind of keep working this and working forward. So if I see there's a problem, what's next? Set realistic goals, right? So I think a lot of times people overdo. So, okay, I'm going to go back and go to 3 meetings a day and have 12 sponsees and, jump into it and just set themselves up really unrealistic kind of expectations. So I would really, once you identify that there may be a pattern here, don't try to rework your life overnight. Start small regarding the number of meetings. If you're on a food plan, be realistic about it. I've seen a lot of people with food addiction get into trouble with like yo-yo dieting, where they'll go on this really strict diet and lose weight, and it's impossible to sustain, and they gain the weight back. And so I think we can do that with all kinds of addictions and in other ways. We can overdo it and really set ourselves up. For me, it's the equivalent of making a to-do list in the morning that has 40 things on it. Obviously, I'm not going to finish them all, and I'm really setting myself up for failure. And to really, and to put it in sex addiction terminology, to really look at our boundary plans. I think that outer boundary of healthy activities that want to keep us safe and really promote high quality of life and recovery, those are the things you really want to focus on. And I really I'm trying to get a lot of my substance abuse clients to really use that boundary plan as well, because it's really useful, that whole concept. 2 more things I think are important. The third is to stay connected, right? I think for me, addiction is all about isolation, loneliness. And if I'm starting to feel complacent, I start to kind of cut off some of those connections. First of all, I'm maybe want to keep it private. I don't want to necessarily share with people that I'm not interested, or that I may be having a problem, or I kind of start to, I know secrets are a really bad thing for me. I don't ever call them secrets, but I don't share as readily as I might, if that is putting too fine a spin on it. But we know that connection is a really healing force for recovery, that if we can have these robust social support networks, they make all the difference in the world for really sustaining our recovery. And that means also staying for the fellowship. I think a lot of people go to 12-step meetings, they zip in just in time to get a chair, and they're the first out the door. And those are important, but I think it can be argued that I think the most important aspect of those meetings is what happens afterwards, that 10 or 15 minutes afterwards, or going out to coffee or a meal, to be with those people. That's the healing part there, or at least part of it. And then finally, the other thing is to really foster a sense of belonging. If I feel complacent, usually the zip has gone out of my life. So I really need to sort of foster purpose, really examine, do I feel like I belong? Am I feeling a little at odds with everybody? When I walk into a group, are people happy to see me? Am I happy to be there? Do I kind of exhale and say, here I am, I feel good. So that's important. I think part of that is doing service for others, not getting so wrapped up in my own thing, and really, bottom line, living with integrity. And to me, integrity just simply means following through, living by my word. If I say I'm going to do something, I do it. If I have a feeling, I own it. If I need to if I'm responsible for something, I follow through. That kind of integrity is something that easily slips away in addiction. And I think it starts to get kind of patchy with complacency. So bottom line, I think it's something we all experience at points in our recovery, but it's really dangerous. And I think people can kind of underestimate how perilous it can be if we don't really take action once we realize we're in that complacent state. I think that's it.
Thank you, David. For anybody who joined us late, our topic is obviously complacency in recovery. Once again, you can ask questions using the Q&A feature. You can do that anonymously. It's right at the bottom of your screen, little Q&A thing. Just click it, type your question. You can also use the chat feature, not as anonymous. And we have some questions. So I am going to jump right in here. Our first one is, are there some things that it is best to avoid in early recovery in addition to not acting out?
Great question. I think, well, clearly if there's things that are somehow linked with addictive behaviors in your past, those things are should be really put on the shelf for a while, or certainly approached with great caution. I think I'd kind of rework your question, kind of put it in reverse. I think what should you be doing early on? I think for me, it was really important to keep it really, really simple. And that meant trying to get enough rest, trying to eat well, trying to be social, trying to pay my bills, go to work, you know, but not have a lot of extra projects going on, because I didn't realize it at the time, because that partly because of that pink cloud I talked about, but my bandwidth was really small. I like didn't have the capacity to do very much or make decisions, and so I really needed to just kind of keep it real simple in the beginning. I think that's important. I think trying to overextend, to jump in too much, to get too well. I tried to just listen, and I think just take it in more than be a problem solver verbally for myself or other people. I just really tried to hear what other people were saying. But that great acronym in 12-step program, HALT, right? Hungry, angry, lonely, tired. I think that was really, there's incredible wisdom in that. It's just kind of common sense, but it really made a lot of sense for me in terms of taking care of myself, managing myself in those early months that really persisted. But I realized looking back, I just wasn't able to handle a whole lot. And I was, I won't go into my story here, but I kind of was in real denial about kind of what a low bottom person I was, you know, starting at going to meetings on the Upper East Side, which I kind of thought were my people, although I didn't live there. And you know, just, I ended up in a really low bottom meeting, and that's where I got sober. And I realized that's where I belong. And it kind of was a mirror of like, oh wow, this is where I need to be. And so just keep it simple, I guess. One way of saying that.
Yeah, there's a half joking saying in AA that they give to newcomers sometimes. You only need to change 3 things: people, places, and things, which is everything. And that is kind of, you know, David mentioned, you know, anything that's connected with the addiction, even indirectly, avoid it. You know, AA has another saying: if you go to a barber shop every day, you're going to get a haircut. You know, stop going to the bar if you're in AA, things like that. You know, stop going to the sex club if you're a sex addict. You know, just because your friends are there, you know, you'll find they're probably not your friends. I also want to echo what David said about focus more on what you should be doing than on what you should not be doing. If I tell you, you know, don't think about the number 9 for the next 5 minutes, you're going to think about the number 9 for the next 5 minutes. It's just human nature. But if you're focused on, you know, going to meetings, getting a sponsor, working the steps, you know, keeping the house clean, eating healthy, maybe getting some exercise, you know, outer circle activities. And David mentioned when he was talking earlier, the sexual boundary plan that we use for sex addicts as, you know, inner boundary problem behaviors, and then it has middle boundary slippery behaviors, and then it has outer boundary healthy behaviors. And I also use that with my substance abuser sponsees, in addition to my sex addiction sponsees, because it's so helpful. It gives you things to do in the outer boundary. Right. So yeah, totally focus on that.
Right. Good.
So another question here. I'm becoming more convinced that I need to be working the steps or some program and also have a sponsor, whatever that means. I don't have access to a face-to-face men's sex addict group. The only face-to-face group is nice for socializing a bit, but it doesn't really follow a program with accountability. Are there ways to find a sponsor online? Someone mentioned that.
Yeah, there are online options. I think it's ideal to have a blend of, you know, real face-to-face meetings if you can, obviously. Sometimes in that situation, if you can't find a face-to-face men's sex addicts group, you might find that in another 12-step group somehow, although sometimes 12-step groups aren't real friendly toward sex addiction and some of those issues. So yeah, that's kind of depending on where you're at and what the options are. In terms of online, there are online meetings. There's in the rooms, Dr. Rob does a meeting there. He doesn't do a 12-step meeting, but there are 12-step meetings on that.
There's a 12-step meeting immediately before Dr. Rob's Friday night webinar in the rooms.
Yeah, so I mean, there are some online options. I think anything is better than nothing. And so I'd really encourage you to connect in whatever way that's an option for you. And I think it's obviously ideal to have people that get you and that you understand and identify with and can have some connection with, because really that connection is what it's all about. But I think, yeah, I don't know what's helping you become more convinced, but anytime I hear someone say that, I believe it's true. And I hope you can find a way to make it work with the steps and a program. For me, you know, and I certainly tried it every way possible until I got into AA. Believe me, if I could have done it, I would have done it without that. And so, but the group makes all the difference, because it really provides a pathway, but with the steps and with the connection. And just, for me, it was a really important part. And that can be replicated online for sure. But I think the important thing is that you connect and you jump into the work and see what you can do. Yeah, Scott, do you have other ideas on what he might do?
You know, all of the 12-step sexual recovery programs have some online meetings, whether they're telephone or video. There's Sex Addicts Anonymous, Sexual Compulsives Anonymous, Sexaholics Anonymous, which is not for everyone, and there's one other, Sex and Love Addicts Anonymous. If you're a sex addict, I would stick with Sex Addicts Anonymous or Sexual Compulsives Anonymous. They all have some online meetings. There are a lot of people who live in areas where there are no 12-step meetings at all, or there's one a week, or, you know, I live in Palm Springs. I moved here, you know, 15, 16 years ago, and the sexual recovery program was terrible. You know, show up, there'd be like me and one other guy, and he had 3 minutes sober. And I had come from LA, which had really strong sexual recovery, and everybody had a sponsor, and everybody was working the steps. And, you know, the first 10, 12 years I was here, that's what it was like. There just wasn't any real program. It was guys who got together and whined about their wives or this week's slip. And then suddenly, we started getting some sobriety, and now pretty much everybody works the steps. So it took, there were about 4 of us, and we just said, we're going to teach people how to do this. We're going to grab people and sponsor them and walk them through the steps, and then turn them loose to be sponsors, and it's working. But if you live out in the middle of nowhere, go for the online stuff, check in with groups like this. If you can find a 12-step oriented therapist, you know, my first therapist, I didn't realize it, but he walked me through the steps, and I'm really glad. So there's always an option, but I would find either a 12-step sponsor in an online meeting, or a therapist who does 12-step oriented work.
And the other thing too, I think, just to mention that programs like ours, you know, it's a 2-week program. It might be something that would be useful to connect and then get that foundation that you need, and then go back and carry on with your online supports. So I mean, there's ways to maybe manufacture in-person intensives, so you can have some contact at least. But yeah, there's some online options. I will say too, just the history of Crystal Meth Anonymous in South Florida, where I live. There was one group in Miami 20 years ago, and there was nothing in Fort Lauderdale. And it started to become a real crisis in Fort Lauderdale. And it just took a couple guys. One guy basically brought a meeting up here once a week, and he had recovery. He wasn't new. And then there were 2 guys, and then 5 guys, and suddenly there were 2 meetings, and it grew. But it really was the effort of one person to get it going. So a few people can really start something, but you need the basic recovery there to begin with.
Yeah, and you know, the purpose of a rehab really is to introduce it, to break through your denial, to separate you from your acting out behaviors, and to give you a grounding in sobriety so that you can go back home and you have some knowledge that you need. So yeah, I agree with David. I think rehabs are always a good idea. Next question. My husband had his first session with the CSAT. DBT therapy was mentioned. How many sessions are usually involved on average? Would it be useful to buy a DBT workbook? So David, maybe you can explain what DBT stands for and kind of how it works, and then answer that question.
Sure. Okay. So CSAT therapist, certified sex addiction therapist, which we talk about here. DBT is called dialectical behavioral therapy. It's a form of what's become kind of the standard psychotherapy, cognitive behavioral therapy, but dialectical really incorporates some other really interesting ideas, including mindfulness, some work on traditional cognitive work on feelings, and it incorporates different kind of skills, emotional affect regulation skills. So it's a really kind of cool package that does turn out to work fairly well with a lot of addicts. It does take some specialized training, but what I really like about it, it's a lot of different skills that the client can learn that really are useful to help regulate emotions, to gain insight, to be aware, to stay in the present. So it's a very useful thing. It's really hard to say in terms of the number of sessions. Sometimes with, say, trauma therapies like EMDR, we can say they're relatively brief, 5, 6, 7. With DBT, depending on the patient, depending on the circumstances, it can go on longer than that. I don't think it's something to be rushed because it is kind of a skill building, awareness building kind of process that takes time, simply takes time to do it. But I think it's a great therapy. In terms of a workbook, yeah, I think workbooks never hurt. In my experience, though, DBT is a little complicated. And it's useful to have someone like guide you through it. I think a therapist who's credentialed in it is a much better kind of guide than just trying to get a workbook and do it by yourself. Although a workbook as an adjunct to someone could be very useful. But it's a great, I really like it because I like a lot of the components. I like mindfulness, for example, and some of the other skills, the affect regulation skills. So I think it's a great therapy. And yeah.
David, can you contrast that a little bit with cognitive behavioral therapy, which is another common therapy for addicts?
Right. So cognitive behavioral therapy really looks at our thoughts, feelings, and actions, right? So it really assumes that our thoughts underlie and create a lot of the emotions we experience. And that if we can become aware of our thoughts and change them, and those thoughts, they may be, misperceptions. So like, I'm always going to screw up, or it's going to be black and white thinking, it's going to be this or that. And those kind of limitations on feelings, and sometimes wrong thoughts, incorrect thoughts, result in painful feelings. And if we can go back in cognitive behavioral therapy, we'll learn how to rework those initial thoughts, and the result is something that's more comfortable. Just as a footnote, that requires a little bit of mental acrobatics in terms of figuring it out. And I found with a lot of the stimulant users, and I've not seen this in literature, but I suspect the same goes with porn and sex addicts, because they're all stimulation intensity addictions. The brain has kind of adapted to them in a certain way. It's really hard initially to do cognitive behavioral therapy just because people are unable to concentrate, they're a little muddled, they're not thinking too clearly, and to do really cognitive-based therapies early on can be tricky. And there's other factors for that. With methamphetamine, if that's part of the mix, people, they're highly visual acute, but their verbal memory, their ability for abstract thinking is reduced for a while. You can get into all kinds of neurology about it. But basically, CBT too early is a problem. That's why I like the DBT add some other things to get around just the brain, the thinking part. It gets into some emotions, some mindfulness, some awareness, some body awareness. So I think it kind of is a better fit for people than just standard cognitive behavioral therapy by itself.
I think most addiction treatment, the two kind of meld and sort of interweave, and people get a little bit of both. I mean, the therapist might say we're doing DBT, but it's probably a mix of DBT and CBT or the serum, or vice versa.
Right.
You know, as based on what the client responds to best, I would think.
And I have a friend who's a certified cognitive behavioral therapist, and he just thinks that all the rest of us are just making, just destroying it because we don't do it in this rigid format. I think every therapist takes it and kind of makes it their own. So, but I think you can't go wrong with DBT, I think.
Yeah. In terms of workbooks for sex addicts, this is a good one. I don't know if it's showing up on my screen backwards, but I assume all of you.
No, it's there, yes.
So I recommend that one. And this workbook really is a kind of a mix of CBT and DBT, the exercises, and it's very straightforward. But your husband's therapist, as for workbooks, your husband's therapist may have a workbook that is preferred, and go with that.
DBT usually comes with written materials for these different skill sets and things. So I would bet they do have something.
Yeah, both things tend to have homeworks and exercises and things to do. So let's go down here. When it comes to isolation, is there a difference between when an addict isolates versus when a partner isolates? So let's start with that one.
Well, I guess, isolation, the behavior is the same in my mind, but I think the motivation may be different in those cases. So an addict is going to isolate, I think, because sometimes shame, sometimes stigma, sometimes just wanting to not have anybody interfere with their addictive patterns or acting out. I started to cut myself off from people who might be judgmental of my behavior. And I found people who acted out like I did. And so my friends tended to kind of gravitate into a group of addicts because we weren't shaming each other or noticing or pointing out to each other the kind of excesses that we were experiencing. So, but that did lead me to isolate from other people that cared about me or might have some judgment about me. So I think it was more in the service of my addiction. The partner isolates. I think there may be often more feelings underlying that, whether it's resentment or anger or fear, or my impression is it tends to be more emotionally driven. For either side, though, isolation is really not a good strategy because it just further perpetuates misunderstanding and whatever addictive processes are going on and hurt and pain. I think it's a common response, and I think we see this in partners a lot, and addicts as well, but mostly partners, where if they become hurt or fearful or sad, oftentimes they'll withdraw, at least for a while, and isolate, and that's not a good place for anybody to be. That's where we see physical illnesses setting in and that kind of thing. Or they get overengaged, they react, and that's also not a good place, where they're responding and reacting in unhealthy ways that's not productive to the relationship. So I think the isolation is really problematic for both, but I think the motivation is probably a little bit different. The addict really protecting their disease process, and the partner protecting themselves, maybe if nothing else, but trying to protect the relationship, trying to get some steadiness in the dynamics that are going on.
Yeah, there's a great TED talk by a guy named Johann Hari. I don't agree with everything he says, but most of it I'm on board with, and I think it's titled "Addiction is an Intimacy Disorder." And the longer I'm sober, the more I understand that. My addiction was about me fearing connection with other people. I was afraid to become vulnerable because I was afraid that my needs would not get met, I'd be ignored, whatever. You know, and that's the result of a dysfunctional childhood, typical addict stuff. And you know, one of the things that Johann Hari says is, you know, the opposite of addiction is not sobriety, it's connection. And that's what I really identify with. The more I'm connected, the stronger my recovery is. If I'm isolating, I'm in trouble as an addict. I can't speak for the non-addicts because I'm not a non-addict, I'm an addict. But if I'm isolating, I'm in trouble. It is not good. Next question. What does a sponsor really do?
A sponsor is a kind of formal relationship. I think I see a sponsor as a guide, a mentor, a friend sometimes, but someone who's not afraid to say what they need to say. It's not just strictly a supportive friendship, although that's certainly part of it. But I've had sponsors that basically kick my ass, and I think that was an important part of what a sponsor needed to do for me at those moments. But it's somebody who I trust to be honest with me, to give me feedback, to be straight with me, to tell me what they think, to be supportive when I need it, to be available. But for me, my relationship with my sponsors, and I've had some over the years, but initially they really taught me about a healthy relationship, because my sponsor had boundaries, they had wisdom, they taught me how to respond and react in healthy ways. And so it was not just the information, although I certainly got a lot of wisdom from my sponsor. The sponsor is someone who's, you know, some ways down the path ahead of me. So they've gone through the steps. They've had some life experience. Hopefully they've have some stuff in common with me, and they have some things to share. Some help me to avoid pitfalls, if you will. But so it's that content stuff, but it's also it was the relationship for me, the ability to connect with someone in a healthy way. And really learn from them and sustain a relationship over time. That was one of the big deals for me in early recovery, is that I really couldn't, I would burn through friends if I had any. I was pretty isolated, but the sponsors we worked it through in a way that I'd never done before. I always just ran. If something went wrong, I started over with somebody else, you know, and friends. And so a sponsor, I really learned how to have a living relationship that was healthy. And so it's not just the content, which is really valuable, but also the way it happened. Now for me, and I had to remind him of this, a sponsor is not a marriage, it's not a partner. You know, a sponsor is not forever sometimes, you know, and I think sometimes I got hung up for a while in finding the perfect sponsor. And it was more important, and I tell my clients this too, it's important that you have a sponsor, even a temporary sponsor. It's great to have a good fit sponsor, but you don't want to delay finding somebody in the pursuit of perfection. So I would really recommend getting even a temporary sponsor, and then looking for someone that you really relate to and that you think could have some value for you.
And there are as many different types of sponsors as there are sponsors. Nobody does it the same. One of the things that I'm really grateful for is, you know, going back to my previous question, you know, or response to isolation about, you know, addiction is an intimacy disorder. I needed a healthy person to model connection for me, and my sponsor did that, and that was, you know, more valuable to me than working the steps. You know, my therapist and my sponsor modeled, you know, empathy and non-judgment and listening and caring, and that was far more valuable to me in early recovery. That said, I think it's very important that a sponsor walks, especially somebody new to recovery, through the steps, because the steps, you know, I needed to be able to connect with people, and the steps taught me how to do that. Right. It was a formalized process that taught me how to do that while working in a conjunction with a person who was modeling it. It was pretty sneaky and powerful at the same time. Okay, I tried to recover from porn for 3 weeks. Last night he went back. Now I feel so hopeless and it feels like there's no end. I'm started questioning my sexuality and everything again. Thoughts?
Yeah, well, I'm sorry to hear that. And I think what you're feeling is like totally normal and understandable after that. I think the good thing is that you're here tonight, you're talking about it. And I think that's, you know, we have slips, we have lapses in recovery. We don't want to encourage them, but they do happen. I don't want to shame them either. It's part of the process in many ways. And I think they're incredibly valuable. And I would encourage you to take what you can in terms of learning from the experience. You know, what went wrong? What could you have done differently? What was there erroneous thinking, thought patterns? Did you have a feeling? How did you handle it? What could you have done differently? That kind of stuff I think is really important to look at. I understand the shame and the remorse that happens with it. And as we've said before in this webinar, shame is like totally useless. It's understandable. We learn how to do it as addicts. We drop into a shame spiral, but there's no good benefit of hanging out in shame. So I'd encourage you to kind of pick yourself up and brush yourself off and really take a look back, an honest look, and see what happened and what went wrong. And then I'd also encourage you, and I'd really keep it, like we were saying a few minutes ago, keep it really simple and focused on the behavior and next steps, and not pull everything off the shelf in terms of your sexuality or any other thing that's been swirling around, because this is not the time to get clarity on that kind of stuff, right? You're dealing with this cycle of addiction where you've just gone through something, you're feeling pain, you're feeling remorse, you're feeling shame, and whatever else you're feeling, but so that's not a good space in which to try to figure out these bigger questions. But I would look at it, if you can, as a gift. You're here, you're back. What can you take from it, and avoid doing that again? So I'm really glad you're here, and it kind of goes with the territory to some extent. So I'd really hope you can give away the shame, put that on the shelf, and just get back to doing what you need to do. And that really, especially what we were talking about earlier, the hungry, angry, lonely, tired stuff, all those kind of basic things, just take care of yourself right now. And don't isolate, get connected. If you have meetings you can get to, if you're lucky enough to have them, go for it.
Yeah, relapse in early recovery with any addiction is sadly pretty common. It happens a lot. Very few people, get into recovery and get sober and stay sober forever. I sure didn't. My first 12-step meeting was in 2000. I'd been in therapy for a while before that. My sobriety date is 2002. I slipped and slid for 2 years. I just did. But I got longer bouts of sobriety as I went along, and it was tough, but looking back, of course that happened. I started drinking and using and acting out sexually in middle school. I didn't have a feeling from about the middle of high school until my mid-30s. I mean, I didn't feel anything because I was always drunk, high, or acting out. So suddenly to take those things away, I had no idea how to cope with anything, even just tiny little things. Oh, I'm out of milk. Oh my God, relapse. It was crazy. And I had to develop skills, working with my therapist and my sponsor and doing the steps and going to meetings and hearing other people share about, oh my God, I had a horrible day, but I didn't act out. Here's what I did instead. I had to hear that over and over and over to finally get it. Like, I have other options. Just because I'm feeling lonely or ashamed or bored or whatever I don't want to feel doesn't mean I have to turn on the computer or my phone and start, scrolling through porn or hookup apps or whatever. There are other healthier options. that usually involve becoming vulnerable with another person, which is really hard for an addict, especially in early recovery.
Right.
Yeah, don't lose hope. There's hope. If I got sober, anybody can get sober. Trust me. So,
yeah. Glad you're here.
yes, and yeah, and you did it last night. You're on here today, coming clean.
That's huge.
If you came back a month from now and said, "Oh, I've been relapsed for a whole month," that's the difference between a slip and a relapse. A slip, you go on last night, you get clean about it today. Good for you. Get back on the horse. Go for 4 weeks next time. Don't beat yourself up about this. It's all of the 12-step programs talk about progress, not perfection. And you had 3 weeks without porn. That's kind of awesome. For an addict, that's awesome. So pat yourself on the back, get back on the horse.
Right.
Okay. Next question. Can DBT be helpful for someone who shows many narcissistic traits and always has, basically?
Yeah, so interestingly, DBT, or dialectical behavioral therapy, is really effective for all kinds of what we call personality disorders, right? So borderline personality, narcissistic personality disorder, and those are the extreme versions. People can have narcissistic traits and not be a narcissistic personality disorder, but DBT is really effective for that because it teaches emotional regulation, it teaches mindfulness and awareness, and so yeah, it's a really good fit for that. So I would say that's about as good as you can get in terms of a clinical fit, in terms of an approach to help deal with some of those traits, because of the awareness and the tools that it helps the person get. DBT started out with borderline personality disorder patients. And
can you explain what borderline and NPD are?
Yeah, so personality disorders are kind of ways the personality is structured. And that we're kind of in the field right now, they're kind of being reformulated these days in terms of how we approach them. But basically they fall into patterns. So we can have dependent personalities, we can have narcissistic, we can have borderline. And the borderline, the term actually comes from people on the border between depression and really kind of schizophrenic or psychotic, that people can have these kind of highly emotional outbursts. Borderlines are largely women. Statistically, they're almost always result from abuse and trauma early on. Borderline really is, I saw someone really summarize them up as like, come here, go away, go away. So that it's sort of, I need you, and then I reject you. And so there's a lot of emotional upheaval around a borderline. And it's all about, we were talking about the importance of connection, the ability to sustain connection. I think that's what borderlines really have a hard time doing. And so DBT is really useful for that. And so, in fact, it's one of the highly effective treatments. For a long time, people with personality disorders they weren't as optimistic about some of the treatment outcomes, but I think that's really changed over the years. But yeah, long story short, yes, it's a good fit.
So then what is NPD and the difference between NPD and somebody who just has narcissistic traits?
Okay, so actually we call it DID now.
Okay.
Yeah, so NPD is what we used to call multiple personality disorder.
No, I meant narcissistic personality disorder.
Oh, you said N, okay.
N.
Okay. Yeah, so narcissistic personality disorder is really more the world evolving. And these are not really discrete because there's a lot of overlap, right? So, but a narcissistic personality disorder person would have a lot of self-absorption. Everything revolves around them, and real inability to tolerate any criticism. Kind of grandiose at times, equally grandiose if they're feeling the worst person in the world. And so it kind of all wrapped up with kind of lots of emotion and intensity, but really focusing on them. A borderline is, I think, more trying to relate. They're dealing with other people, but they still can be very self-centered, but they also can be quite needy and sometimes manipulative, but I think ultimately almost more relatable than a true narcissist. So again, these are kind of flavors of the same thing, but and it's hard to differentiate sometimes, but they all result, I think, from trauma or some unusual childhood, some kind of dysfunction. And they're really ways that a child can cope or tries to cope. And these aren't conscious processes. Growing up with abuse and trauma, a child does the best they can. And sometimes that means compartmentalizing relationships into different aspects and cutting off parts of themselves and dissociating and all these things they do to survive. And that, of course, we deal with that as adults then when that's gone on. So personality disorders often are accompanied by addiction. So we often see them. We do see a lot of sex addiction and narcissism. Those two go together really well. Most narcissists tend to be men. Most borderlines tend to be women. But all of them are prone to addiction or addictive behaviors.
Yeah, absolutely. I'm realizing I skipped a question earlier, so I'm going to go back to it. We had the question earlier about, is there a difference between an addict and a partner when they isolate? The same question for complacency. Is there a difference between an addict and a partner when they lapse into complacency?
Yeah, I think my first, I haven't really thought about that before, but my first impression is that an addict who's in complacency is kind of, to me, the recovery is getting a little stale or kind of going on autopilot and vulnerable to upset or kind of disaster if something goes wrong, just because they're not kind of paying attention. Complacency in a partner, from what I've seen often, is really about kind of a withdrawal from the relationship. It's really more of an expression of pain, emotional pain and hurt and fear, and kind of these are not conscious strategies, I think, for the most part, but it's a strategy to keep safe. You know, if this is a really dangerous relationship and I'm going to keep getting hurt, one way to deal with that is to kind of just take a step back and become kind of complacent about it and not be as invested in it. So I think that's one strategy people have sometimes. Again, the behavior is the same, but I always look at the motivation. What's going on? What's it doing? And I think partners, when they get complacent, often I see if there really is, if they have kind of one foot out of the relationship because of fear or sadness or hurt or whatever. Complacent, though, for a partner or the addict is not a good thing. We need people to be involved and actively talking about what they're feeling and seeing and experiencing. So
yeah,
it may look the same, but I think the motivation is different.
Yeah, more questions. Okay, I'm a sex and love addict and an alcoholic. I've gotten sober from alcohol, but have yet to be able to maintain no contact with my current acting out partner. Do others typically quit substances first and then eventually fully commit to sex and love addiction recovery? Sex and love addiction seems far more difficult for me to face, or more deeply rooted, powerful. It's scary. Thoughts, David?
Yeah, so it's interesting. We sort of what to treat first, right? The classic protocol is that if we have an addiction in the mix, that must be treated first. Because if you have somebody who's a substance, I'm talking about substances, a substance abuser, it's going to be really hard to do any kind of other therapeutic work just because the physical addiction really keeps the thing going. What we've known with chemsex, what we do at Seeking Integrity, and oftentimes if we see somebody coming in with a sex addiction who also uses substances, we really see that we have to treat those simultaneously. Because the thought for a long time in the field was that, well, if this person's acting out sexually and they're using drugs, if we can just get them clean and sober, the sex will take care of itself, right? And that doesn't happen because the sex addiction is also a thing. And so ideally we treat them all together. And because they're all interrelated and they support each other and they increase the risk of relapse for each other. Now, what you're describing here is not that unusual, where people do get clean and sober from drugs, and then these other behaviors that maybe were masked by that addiction start to become more evident and clear. I guess at this point, though, there's no wrong timing. If it's an issue that you've identified, I think it's time to work on it. And sometimes those issues are much harder to deal with, as you really accurately describe. I'm an alcoholic. I gave up alcohol. I don't ever have to drink alcohol again. I don't have to deal with alcohol again. But a sex addict has to learn how to incorporate healthy sex and intimacy back into their lives. And so a food addict has to learn how to eat because they can't just give up food. And so the process of behavioral addictions are harder, actually, to kind of weave back in healthy ways. So I think I'm not surprised that you're struggling with that. But I would just say you've gotten sober from alcohol. Those same skills and whatever you've done to do that, I think are directly transferable to this other problem. It's just a kind of different set of dynamics, but I would take the knowledge that you've done it for one thing and that you can absolutely apply it to this other thing. But I think the struggle is, frankly, giving up alcohol on the face of it is kind of easier than sex addiction, I think, just because I can say I don't have to deal with that again and walk away. I don't want to do that with sex or love or relationships, obviously.
Yeah, I have some thoughts there too. First of all, your question about what the usual pattern is. Most people get into sexual recovery after they've gotten sober from alcohol and drugs. I did it the opposite. I got into sexual recovery first because that's the one that was killing me. But I'd say 98% of the people who have multiple addictions, such as me and you, they'll get chemically sober first and realize, oh my God, my life is still a mess. Why? Oh my God, my sex life is out of control. And then we'll come over to sex and or love addiction recovery. I think sex and love addiction recovery are more difficult for the reasons David stated, and also because our underlying issues deal with intimacy and vulnerability and fear of other people. And sex and love addiction, I get drunk and I just don't have to feel my shame. But sex and love addiction, if I get somebody who wants to be sexual with me, well, that's like directly attacking my shame, at least for the moment. It's a much more powerful drug for me. Sex was always the more powerful drug. Alcohol and other substances were, they did the job, but not like sex did. And then you have to, we don't want to eliminate sex completely from our lives. That's not healthy, particularly for people in relationships, which I'm not, but I don't know if you are or not, but you're affecting other people if you walk away from sex. So, it really is like an eating disorder. You have to learn how to do it in a healthy way. My eating disorder friends, they say, it's not like I can never have ice cream again. I just can't have the whole gallon. I get like a scoop. And we have to learn to be okay with that. It's very difficult. A few minutes left. Next question. I have a tendency to fragment and never work any program well. It sounds like you're doing about 6 different things at once. Which is better to do first? Patrick Carnes, A Gentle Path Through the 12 Steps, the Lasser's A Life Recovery Guide, or Rob's this book. I'll just say, for me, this one, I have tried to use the Gentle Path book with sponsees, and it's about an inch thick, and it's just too much. I don't know the Life Recovery Guide, David, do you?
I do not, actually. Although I totally agree with what Scott just said. I have also worked the Carnes book, and
it's too much.
It's too much. It's hard to get through. I get bogged down, and I stop. And the Rob's book it's much clearer. It's simpler. It's direct. So I would do that. And in terms of, it's really important to just follow up on your point about fragmenting with too many different programs. I think it's really important to pick one or two and one ideally and stay. And I've had some success in going to my main fellowship, but using the principles for any addictive behavior I have. I don't have to go to a fellowship for each of my many addictions, right? I can practice my recovery in one group and apply it. That works for me.
Yeah, I mean, to our person who, I think this might be the same person, who did not have any good meetings in the area and was struggling to find a sponsor, maybe go to an AA meeting, whether or not you're an alcoholic, and work the steps with the sponsor there, and just let that sponsor know, this is really
Exactly.
my issue, but I really need help, and I can't find it anywhere else, in the vicinity, because there are AA meetings everywhere. Every day, everywhere, there's an AA meeting. So yeah, that's a thought there.
Yeah.
But as far as books, I like Rob's book for sex addicts. It's very direct. It's focused on sex addiction. Pat wrote his Gentle Path book for all addictions at once, and it's just too much. And the Lasters deal with sex addiction and other addictions. I don't know their guide though. Got time for one more real quick, David?
Yeah, sure.
Because we got one more here. Sounds like this is somebody who's a drug addict. How will I know if I'm dealing with it says narc, but I'm gonna say drug addict who is acting out, or just the drug addict? He's saying he's 10 months sober, but he's acting worse.
Well, I mean, all you can do is evaluate behavior, right? That's an addict will say they're doing fine, and they may very well be doing fine, or they may not be. But I think it's really hard to just base everything on the word, but really to look at the deed and how the behavior is and what it's looking like. I think that's the only thing I can say about that. I mean, just I've had clients who said they're doing fine, but clearly their behavior indicated that they weren't. And so I think just all we can do is really look at the behavior and set good boundaries for ourselves too. If there's that kind of confusion in a relationship, a good boundary, I think, is an expectation is useful to talk about and set out in that case.
Yeah, there's a lot of things that could be going on there. I mean, a lot of people in early recovery, they get on the pink cloud like David did. A lot of other people in early recovery get really nasty, like I did, because you took away all my coping mechanisms, and I don't know how to relate to other people other than to numb myself or lash out. Yeah, but
we've talked before about people that are years sober who aren't really working a program, who are angry, or so it doesn't always indicate active use of substances, but it has to be suspected at least.
Oh, that was okay. We got a clarification. That was a question about narcissism, not Narcotics Anonymous, but I think the answer is the same.
Okay, sorry about that. That was cut off on my screen. Okay.
Okay, everybody, thanks. We are out of time.
Yeah.
David, do you want to wrap us up here, or?
Yeah, just beware of complacency. Don't let it grab you, and stay actively involved.
Okay. Thank you, everybody, for coming. We will be back next Wednesday, same time, same place. David, thank you. And
thanks, Scott. Thanks, everyone.
Next week.
Bye-bye.